So let's go through how to use this approach to cough schema. Now remember, this schema does not include every cause of cough, but it includes the vast majority of them, so that's what makes it an excellent place to start. So unlike our schema approach to chest pain, where you really have to parse through each diagnosis or condition in order to establish your ranked differential diagnosis, the approach to cough is different. It'll have two distinct steps that will help us narrow down the differential diagnosis dramatically. And the first step is the question, how long have you had this cough? See how in this first step you immediately separate between acute and chronic cough, which have their distinct sets of diagnoses. If the cough duration has been shorter than 3 weeks, we call that acute cough. If the cough has been going on for longer than 3 weeks, we'll call it chronic cough. Once you're in the category of acute cough, you really only have to decide between two conditions: a viral upper respiratory tract infection, a common cold, or pneumonia. So how do you tell the difference between a cough caused by a cold and one caused by pneumonia? Well, most of you have had a common cold, so you know what that feels like. But many of you have never had pneumonia, thank goodness. But if you ask somebody who has had pneumonia, they'll usually tell you they felt a lot sicker than when they had a cold. And they may also tell you about some common symptoms that you hear going along with pneumonia, like fever or shaking chills. Now you may be surprised to learn that there's no definitive way to tell the difference between a cough caused by a cold and one caused by pneumonia. And it's not for lack of trying. Researchers have tried to put together all sorts of scores that try and separate the two, including the research that's summarized in the Journal of the American Medical Association's compendium on the evidence-based clinical examination. Now we've looked at that reference before, and really in terms of pneumonia, their conclusion is there's only one way to diagnose pneumonia, and that's with the chest x-ray. Now how do you get to a chest x-ray? That's with your level of clinical suspicion. And your level of clinical suspicion will increase as the number of typical symptoms increases. So if the person has shaking chills and a fever, they probably warrant a chest x-ray, and it's the chest x-ray that will tell you whether they have pneumonia or not. So back to that all-important first question around cough, and that is, how long has it been going on for? If the cough has been going on for longer than 3 weeks, then you're into the chronic cough territory. The first two questions in the chronic cough category will be to eliminate ACE inhibitors and COPD as possibilities of cause of chronic cough. The first one, ACE inhibitors, will be easy to eliminate. You ask the patient, are you on an antihypertensive? And then figure out what class of antihypertensive it is. And then the second question will revolve around their smoking history, because smoking is so closely associated with chronic obstructive pulmonary disease that if they smoked for a long time, you can be pretty sure that their cough is caused by smoking. If they haven't smoked for that long, then it becomes a bit trickier. So if you eliminated ACE inhibitors and chronic obstructive pulmonary disease as causes of chronic cough, you're left with three possibilities: asthma, GERD, and PND. So now that you're down to three possibilities, you may want to sort through the three and see which one is more likely based on classic symptoms. Does it sound more like GERD, or does it sound more like asthma, or does it sound more like postnasal drip? You may never get the right answer. In a classic study in 1999, Palombini and others show that 93.6% of all chronic cough, not caused by the things that we've already eliminated, was caused by either one or two or three of these diagnoses. So you may be stuck ultimately doing what we call a therapeutic trial, and that is figuring out that this may sound more like asthma than the other two, so I'm going to treat it as if it is asthma and see if it goes away. If it does, you have your diagnosis. If it doesn't, then you try another one. If it only partially goes away, you may try two therapies. So let's summarize. We started off with a patient with a cough, and with one question we were able to sort that patient out into two possible groups. Is it an acute cough, less than 3 weeks, or is it a chronic cough, more than 3 weeks? If it's less than 3 weeks, really all we have to do is sort out whether it's a cold or whether it has enough symptoms to deserve a chest x-ray, which is the only way to prove that they have pneumonia. If the cough has been going on for more than 3 weeks, our job is a bit more complicated. First, we have to eliminate the possibility of an ACE inhibitor or chronic obstructive pulmonary disease as a cause of chronic cough. Once we've done that, though, we have 3 diagnoses that are left. Those can be partially teased apart using classic symptoms and maybe ranked in the order of what may be most likely. After that, sometimes it requires a therapeutic trial in order to establish which one really is the culprit.